Well, appreciate you taking the time on a Saturday afternoon to come on and share this opportunity. Well, we're excited to have all of you, and I'd like to introduce Andrew.
Yeah, so nice meeting everybody, and thank you so much for taking value time out of your weekend to meet with me, and I'm really truly grateful for that. So a little bit about myself. For the last 2 decades or so, I've done actually quite a few different businesses. One of the main ones was a healthy food company called Perfect Fit Meals. Ultimately, something that I started off, smaller than mom and pop operation, and built into a quite a big organization with almost 300 employees with about 5,000 retail locations that carry the product in 38 different states. And then, in 2019, we were able to exit. And immediately, a lot of different companies that saw what we did with our own company came to us and basically said, "Hey, can you do something like that for us?" So basically, what we did was we created a separate company, and essentially we became the sales and marketing arm to a lot of different manufacturers, six to be exact. And we applied the same principles and same formula, and essentially, help them build up their brand, taking them from small regional players into national players. And essentially, that's what I've done in my career in the last 20 years. Is we develop systems, and to be honest with you, I can't take credit for all of that. We have smarter people than myself develop the system, and what we're really really good at is building a brand around that, and basically expanding and growing the brand, so to speak. As we all know, at the end of the day, uh, whether you have the best product, but however, unfortunately, if nobody knows about your product, the product's not going to go anywhere, right? And even if you don't have the best product, but you let your customers or your clients feel that they have the best product, then at the end of the day, you're completely golden. So sorry about that. I think there's more people coming in, and all right. So, essentially how I got with this opportunity is, after we exited our company, and then we grew the second company in the sales and marketing aspect of things. When COVID hit, I speak Mandarin Chinese as well. And we started importing a lot of things that we noticed, where there was a disruption in the supply chain. And that was a separate company that we set up, bringing in everything from raw materials to packaging to chemicals. So essentially, basically looking at where there's deficiencies in the U.S. supply chain, and we supplied that. That company basically took off. And when the labor force collapsed due to the fact that the government was sending out stimulus checks and people weren't showing up, we set up a automation company where we brought in a lot of automation equipment, and essentially, streamlined these production facilities, and knocking down, the number of line employees that was required to basically keep the assembly lines going. So in one sense, we're creating jobs with one company, and then another in another company where I'm the asshole that's responsible for killing jobs in the U.S. Right? And how I got involved with Texas Care was, Charlie Williams, the owner of Texas Care. He and we actually known each other ever since they exited out of their company. They used to run a very, very large clinic in Louisiana, and with over 200 clinicians. And they exited and moved from Louisiana to Houston. And we met about 8 years ago, and we hit it off immediately. But due to the proximity of where he moved to Houston, and Houston, for those of you guys don't know, Fleetwood, you probably had an idea when you got here, is extremely spread out. So he moved to the far, far, far north side, and I'm in the far, far southwest side. So just due to the proximity, we weren't hanging out every week. But we always kept in touch on what kind of projects each other was doing at any given time. And to be honest with you, life was pretty good. Semi-retired, and basically it was a lot of the business, especially on the import-export side, was very, very passive due to the fact that whether I'm asleep or on a beach in Cancun, the boats are still running, right? So I was actually looking for more ways to basically put my money to work, and that's how I met some of you guys as well. The trucking thing was the trucking automation was one of the things that I was looking in towards, and essentially, basically, I was looking for more of a passive investment, and Charlie actually got to me, and basically we met up, we caught up, and basically said, "Hey, so many people were asking us about our clinics that we decided to do a franchise model." So me looking for an opportunity, basically I said, "Hey, Charlie, I trust you. We've known each other for years. I know you're doing well. So what's it going to take for me to get involved with this?" And basically, I was blown away when he showed me the P&Ls, and I put my money where my mouth is. Immediately after our lunch meeting, I wired him the money and got started. So initially, in the beginning, I mean, I'm not going to lie, it was all about the investment. It was all about the return on investment. And in the beginning, it was all about money until I got a little bit more involved and really heard what goes on behind the scenes, sat in on some of the QMHP meetings and really dive into the story of, how the work that they're doing is really impacting the lives of children, right? And I had no idea. All of us on the call, we live in a very sheltered society due to our financial circumstances. But if you really look at the world, is a pretty messed up place. And for us, you know, when I look at this, and what I've learned is that 98% of the counties here in Texas are deemed in mental health crisis, right? And we really noticed that with social media, with all the things that's going around, mental health issues is not getting any better anytime soon. In fact, it's getting a lot worse, right? And some of the stories that I heard, and especially having little children of my own, really, really impacted me. And basically, what we have done is, you know, work with Charlie and Ariane, looking at the system that they already built and have multiple decades of experience on. And what we've said is, hey, if I was able to put our brand building and our business aspects and marry it into the system that you already built, what can we accomplish? And so far it has been an extremely successful model. In the last 8 weeks, we actually sold over 25 franchises, and it's growing by leaps and bounds right now, and it's actually accelerating because the word is actually getting out. Some of the stories that really impacted me is I found out that the kids that hurt themselves and especially they cut themselves is due to sexual trauma, right? And like I mentioned, having two little girls of my own, stories like that really, really affected me. And whenever society sees, some kids that are hurting themselves, or just really affected by the trauma that they go through. Whenever society sees, like, for example, we were working with a little girl, she doesn't speak. Not because she's medically mute, she just doesn't talk, and then she cuts herself. Whenever society sees something like that, they just see, hey, that's a weirdo. Let's go and stick her in the corner, put her on the short bus. Nobody go talk to her. She won't talk to you, right? Until, uh, people like us start working with her and we find out why she's the way she is, right? And we found out that she lost both of her parents, right? Not because they were in a loving relationship, and mom and dad went out to dinner one night and didn't come home because they got hit by a truck. The story that we found out why she is the way she is that you know the she witnessed the death of her parents. The father, due to all his trauma overseas, lit basically doused the mother in gasoline, lit her on fire, and then blew his head off with a shotgun. Right. And because she lost both her parents, she gets thrown into the entire foster care system where she gets abused every step of the way. Uh, Stories like that are pretty extreme. However, what essentially we're trying to do is we're trying to provide a service where it's essentially a big brother, big sister program, working with these kids, identifying their trauma, and then teaching them life skills to make them into productive citizens, right? Essentially, our mission is to keep them out of emergency rooms, out of the hospital, out of jail, and ultimately out of the morgue as well. And luck has it for us that this is also a very lucrative program because here in the state of Texas, with Medicaid, is all government money, and the way we work is we actually have a very unique model where QMHPs, which is the qualified mental health professionals, they're bachelor level professionals that work underneath our licensed clinical supervisors, and they go out there into the back houses. They go out to the bad school districts, and they work with these kids, and we pay them anywhere from $25 to $35 an hour, and we bill the state of Texas 102. So it becomes a very, very lucrative program for us as well. And just a show of hands and a quick feedback. Were you guys able to see the P&Ls?
Yes, I did look at the P&L statement, and it was
Yeah,
$336,000 for 2023, roughly. So,
right. Yeah,
yeah.
so when I saw that, I
Mhm.
was completely blown away. It is definitely one of those that, it's one of the strongest I ever seen because the
Sorry,
gross is so steep.
can I
Yeah.
clarify too? I think the line item was like net revenue or net operating. I forget what the title of that line item was, and it's always a little confusing because there's like revenue, there's not. So can you break down that final total sum amount for us? The
Yeah,
after
so I
expenses,
mean,
I think. But,
sure, sure. So if you take a look at the P&Ls, the P&Ls are so strong. I actually don't have the P&Ls in front of me, but we could go in and clarify
okay, no problem.
more of that a little bit later. But the reason why the P&Ls are so strong is not because of not because the gross is so impressive, but at the end of the day, the reason why it's so strong is because there's hardly any costs associated with this, right? We all have done business before. It's not how much you bring in, it's how much you get to keep, right? And with the way our program is designed, 90 to 95% of the work is done outside of the clinic in the communities, right? And this is where it is most effective because with these kids, whenever they have these programs where they're required to come in and see a counselor once a week, and then what they do within that hour, and then they send them immediately right back into the crack house, the effect is almost zero, right? So with our program, it's so effective because we get to work with them on their environment, and that is why this program is so successful. And ultimately, it really saved the state a lot of money, and they realize this is due to the fact that those kids that cut themselves, if they wind up in the ER, Medicaid's paying $20,000.
I know one of the things about the P&Ls, just something to add, you guys. So the gross I think was like right around 500,000. The net on that one was 330,000.
Yeah.
Then that's the owner's P&L. So there's a couple of fees that are not taken into consideration. And can you let these guys know what those fees are and kind of what the end number might be? And that's off of 30 kids, by the way. And there's a potential to have 50, 60, even 100 kids in one of these, but that one's off of 30 kids.
Right.
Yeah. So with the franchise model, there is a 13% royalty that is tied in. That is based off of the gross, right? A lot of people ask, that's not familiar with franchise models. With franchises, it's always based off of gross and not net, due to the fact that we as corporate cannot basically stop you from hiring your brother or your son and paying them $400,000 and then showing a net zero on your
Right.
P&Ls. That's one of the main reasons. And then there's a couple of other line items that wasn't included in that is whenever you guys get started, we actually provide and corporate will be basically your clinical supervisor, and all your QMHPs, your qualified mental health professionals, will be operating under corporate's license. These licensed professionals are ultimately responsible for all your QMHPs, and that is one of the reasons why we hire and we train all of them, due to the fact that we want to make sure that that the QMHPs doesn't go out there and do something that may jeopardize our license, which is a very good thing for all the investors involved, because it truly makes it a pretty passive investment.
So on that P&L statement, for an example, let's use easy numbers. Say the gross was $500,000. So
Correct.
13% of 500,000 is what, $65,000. So if my net income is 330 minus 65, that's 265. So 265 in my pocket, 65 to the franchise fees, or any other fee or any other thing I'm missing there.
There are the clinical supervisor. So until you get to about 30 clients, corporate will act as your clinical supervisor. Now, all of these clinicians, we do hire the best of the best. The average clinical supervisor, gets paid about $80,000. We pay ours 120. Due to the fact that we want the best of the best with 20 years of experience to handle large caseloads. And so that would be an additional $2,000 a month. And then we do have a marketing fee of $1,000 a month. But even if you add another, $36,000 to that P&L, it is still very, very strong.
That's still, I was at like what, 265 minus another 30K, so we're at like 230, 225, something like that. I still think that's where I'm at. So that's still extremely well. Yeah.
And that's based off of 30 kids. There's no reason why the clinic can't have 50, 60, 80 kids. And one of the things I might ask Anton to share with everybody is the Medicaid fact sheet for the state of Texas. You can realize, and I didn't even notice this, right? Every single Medicaid recipient qualifies for this program, especially with the kids, right? And the beauty about this is Medicaid is the best insurance policy in the world. It has zero copay. Unfortunately, you and I, we just don't qualify for it, right? And I didn't know this until I got involved, but 3 out of 8 kids in the state of Texas are on Medicaid. So if you think of all high schools, all the middle schools, all the elementary schools, 3 out of 8 kids, that's a lot of kids.
Yeah. Question. You said all over the state of Texas. Does the franchising headquarters, do they kind of target certain zones? Like, I'm targeting this zone because we just think it's a good market? Or is there a little bit of a, hey, I live in Dallas. Hey, I live in Houston. Is there any opportunity in those cities? And I have a little bit of a preference.
Sure. So currently, right now, we're targeting the major metropolitan areas and the surrounding cities in those areas first, due to the fact that corporate will set up regional headquarters in those areas, and that's where we're going to offer the most amount of support. However, as we grow and very, very fast, we will want regional headquarters in every single zone, and there's currently 10 zones in the state of Texas.
Okay. Like, I'm from Houston, so I'm a little, I know you're from Houston too, so shout out to Houston.
So we definitely need to meet up. Come on.
All right. Yeah, I'm there. Let's go.
I have a quick question. Is there any chance of maybe like putting too many locations close to each other so there's not enough clientele to go around, or do you figure out how to space those out?
Yeah, so there's not a a big risk about this. I mean, everybody is worried about territories. However, you got to realize, Fort Worth just opened up, and we did two separate community outreach events. We essentially went to low end apartment complexes, and in one event, within an hour and 30 minutes, we signed up 14 kids. And the second event, in 2 hours, we signed up 22 kids.
Beautiful.
Yeah, Andrew, I think one of the things that you mentioned in our last call is your partner and the community, the event center that you have. Can you just talk a little bit about what you're going to do with that?
Yeah, sure. So one of my personal locations, I have a business partner that also owns a event center. It's Park 8 Event Center here in Houston. Feel free to Google it. It has basketball. It has indoor basketball courts. It has indoor swimming, indoor soccer. So these type
What's the
of
name of it
events.
again? Sorry to
It's
interrupt.
called
What was the name of it again?
Park 8, like PARK and the number 8.
Okay, thank you. Okay, cool.
Yeah.
Thanks.
So we're putting a Texas Care location in there as well. And basically, we're actually on May 18th, we're actually doing the first Medicaid summer camp for these kids. Now, we're also talking about low privileged kids. The chances are any of them been to a summer camp is probably zero. In fact, this thing has attracted so much attention that the mayor's office is even involved now. So, the of these type of things, and I want to give you guys a vision on where Texas Care is going. Is that these are the type of programs that for so long it's been extremely underutilized, and now the beauty about this is that we're shining light on what kind of benefits that these people already have, and by the way, it costs them nothing. The beauty about this entire thing on the business aspect of two major things. Now, for those of you guys in Texas, I'll go ahead and make an example. I don't care if you open up a dentist office or a burger joint, right? Traditionally, if you open up in the border town or Podunkville, Texas versus downtown Austin, in downtown Austin, you have to charge 10 times as much to cover the overhead, correct? Right? However, with this is probably the only business that I know. Medicaid pays $102 per billable and reimbursement. It doesn't matter if you're in the border town or downtown Austin. And this is the only business that I know that comes in with a built-in referral program. And let me elaborate on that. Is that take a look at most Medicaid recipients. Look at the demographics. Single mom, multiple kids. And usually, if you are able to help the worst of her worst kids, guess what she's going to say? Especially when it costs her zero. Please take all of them. And guess what she's going to do? She's going to tell every freaking relative, every friend, every neighbor that she knows about. And that's how we're able to get so many clients into these centers so quickly.
You also have
Hey,
to work in relationship with schools and like local sports programs and things like that to try and bring kids in.
So, our community outreach people, they go out to schools, they talk to the counselors, they talk to the principals, and I actually had a Zoom meeting similar to this with the Cy-Fair School District. I didn't realize that Cy-Fair School District is the largest school district in Texas.
Can I interrupt a little bit? I went to Cy-Fair School District. I went to Cy Falls IS. Yeah, I went to Cy Falls, and my brother went to Cy-Fair, and a lot of my family. So funny. Anyway, keep going. I just want to interrupt.
So, we were on a call with their social worker. Substance abuse among their adolescents is getting so bad, and there is so little help. Remember the mental health crisis that we're having, right? That they're thinking about partnering up with a facility in San Antonio, busing these kids all the way from Houston to San Antonio and busing them back. And basically, what we said is, I mentioned on the Zoom, I was like, so if we were to put a facility, and she cut me off immediately, right? She goes, if you have a facility in Cy-Fair, we'll go with you. She didn't let me, she didn't even let me finish.
That's great. That's fantastic.
So
well, I live in Cyprus, so dibs on being a part of that, by the way.
I gotcha. And the beauty about this is, guys, I mean, the offices that you're going to set up, we have, it is very, very smart for us to put these facilities and these offices near where the help is needed. Well, this is one of the only business that I know that those so happens to be very low rent areas due to the fact that that's where pardon my language, but the bad side of town, right? But that is the beauty of this entire program from a P&L standpoint, is that, hey, it actually works in your favor. That's where all of these Medicaid recipients are, and so happens that your rent is going to be super, super low because it's in a low income area.
So when someone signs on, since we're from Boston, so we don't really know anything about Texas at all. So we'd assume, do you have places already set up that you want to put franchises, or do we work together and figure out where it's going to go, or how does that go?
So, we will work with Tech Associates and all their affiliates. Basically, we will work with you. We will have suggestions on where to put these clinics for you. And the beauty about this is Texas is wide open right now. Even the areas where we have concentrations where there's the most amount of corporate support. However, if you're talking about just Dallas and Houston alone, which we will have regional offices in Dallas in the next coming months, we already have a very solid regional team here in Houston. Houston Metro is like what, 5, 6 million people. There's plenty of areas to go around. I mean, honestly, in Houston Metro alone, you could have 100 of these locations, and you won't even touch each other.
Okay.
It's very true. Like just in the Cypress area alone, like there's clusters of elementary, middle, and high school. And like that's a cluster. And then down the road, there's another cluster. And down the road, there's another cluster. And down the road, there's another cluster. And they could all be a mile apart. And there's still access to so many kids. It's really insane.
So basically, every location's a win, is what it sounds like.
The win, brother. It's a win.
Sure.
See, I did a question about staffing. How many staff do you typically have per office?
So the QMHPs. So the only staff that you'll need for office is the only staff that you'll have on payroll, so to speak, or on salary would be your administrator. That person will be basically the front desk person that answers all the calls, that does the office administrator things, and then also work with medical billing to ensure that the clinic gets paid, right? So, I assume that there's no physicians on this call because as soon as we mention Medicaid, most physicians immediately their antennas go up. And we actually have quite a few physicians as investors. In fact, some of our biggest investors are physicians. But in the beginning, all of them, I say all of them, were very, very apprehensive about working with Medicaid due to the fact that they know what kind of challenge that is. Well, on the medical side, there are hundreds and hundreds of codes, right? So if you accidentally put the wrong code in, you either get paid a lot less or you don't get paid at all. For us on the psychiatric side, we work with 4 codes, and 95% of all of our cases is 1 code. And that is why with our system, medical billing is so simple. In fact, your administrator or your front desk person could do all the medical billing for the day in about 5 minutes.
Right.
Andrew, I have a question.
Hard to screw up 1 code. You know what I mean?
Yeah. Hypothetical. I'm in next week. I give you a call. I make the payment up. Here's the money I need or whatever. I'm all in. Give me a hypothetical. It's a 7-month kind of startup time. It's going to take this thing. The first cash flow, if everything kind of goes perfectly, I understand every scenario is nuanced and unique, but you get the idea. Just give me a very run-of-the-mill hypothetical way this thing could unfold, going from I give you the payment, let's say Monday, to the payments start going in my pocket, like that timeline.
No, that's a very, very good question, Joe. So, the beauty about this entire business model is it is government money, which makes it extremely recession-proof. In fact, I would argue that during a recession, we actually do even better due to the fact that the single mom that just got her hours cut, unfortunately, sometimes they take it out on the kids, right? That's the beauty about this. The bad thing about this and the ugly, and I'm going to be very, very transparent, is that you're still working with a government entity. even if you provide all of the documentation that we need to get you accredited, it is still a 6 to 7 month process due to the
Correct.
fact that with Medicaid, there are different steps, and unfortunately, you can't get to step 2 until step 1's completed.
Correct.
And there's a lot of government bureaucracy. All of us that that build anything, you understand how that permitting process goes, right? You can't start construction until you have the
Yes.
permit, and the permit is, it's hurry up and wait. And that's why we tell all of our investors it's up to 6 to 7 month process. It may be shorter, but we try to give you the worst case scenario.
Yeah, that's what I'd like to hear or whatever. So then, like, again, it takes 7 months, all the government, blah, 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 blah. And then again, the payouts, are they typically monthly payouts? Are they quarterly payouts? Are they annual payouts? How do you guys typically manage that?
So the beauty about this also is that you'll have an entire portal through your electronic billing. So every time something is submitted and whenever you get a reimbursement, you'll actually see all of that, and it goes directly into your account.
Oh, beautiful. All right, well, I'm prognosticating the future, but I'll probably be making a phone call to you guys here next week and try to start getting things going. But
for sure.
You also want to touch on again on the community outreach and hitting the road, like hitting the ground running when the clinic opens.
Oh, I had no idea.
With the outreach.
Yeah, for sure. So, once again, you do have a lot of corporate support, and we actually designed this to be a pretty passive investment, due to the fact that, well, it has to be passive because, it's not like a burger joint. Your manager didn't show up, so you got to show up and open up and cover the space or the time that nobody showed up to manage the place, right? For us, I mean, unfortunately, and this is not being derogatory, none of us is qualified to do this work. We're not certified to do it. So by nature of that, it is a very, very passive investment. Like Eric was asking, the says to get the clinic open. Now, once again, I have to address, right, that your 6 to 7 month does not start until you get us everything that we need. Setting up the LLC, setting up the EIN numbers, setting up, all of the requirements to get the process started for accreditation, right? One of the gentlemen, the guy that I own the facility with, I mean, our people were tracking them down, and it's been 2 months, and he finally got everything to us. And then he's calling. He's like, "Hey, when's the clinic going to start?" I was like, "Well, 6 months from now." He goes, "Well, I thought you said 6 months." I was like, "Yes, 6 months from the point that you give us everything that we need." Fortunately, we're working together with TED Associates to streamline and automate that entire process, making sure that we get everything that we need in a very, very timely manner. None of this stuff takes a long time. To get a Texas LLC set up, in the Secretary of State website, it takes like 2 business days. To get an EIN number set up is like 5 minutes, but you still got to take the time to do it.
I actually just did it in Texas. I think it was $399, and it took like 24 hours after I submitted it. Like, I just did this 2 months ago, so it was fast. LLC, yeah.
Yeah, correct. So, like Eric mentioned, we actually so during this entire process, corporate will be working with you every step of the way, right? And then we'll basically give you a status report on where everything is. So right around month 5 is when our corporate community outreach and marketing team will start going out to areas around your clinic, and we're going to start target marketing your area. And working with the schools in the area, talking to juvenile detention officers in the area, talking to the emergency rooms in the area, identifying who these kids are, and then doing these events, whether it's at an event center or in the apartment complexes. And guys, this is really cool because our goal is as soon as your doors open, you'll have a full caseload. Even I was shocked on how easy it is to get these kids involved. Our community outreach, and so Fort Worth opened up 2 weeks ago. they're already over 30. They have over 35 clients. They just did another community outreach program, talked to over 30 parents, and probably going to wind up getting another 50 clients overall. So, I mean, you think about it, right? Whenever you go into these low end apartment complexes and you bring 10 pizzas, you talk to the apartment manager a couple of days beforehand. These kids are not used to getting anything handed to them, right? So whenever you say, hey, there's a pizza party, bring your family, bring your kids, they come out in droves, right? This is an opportunity for us to talk to the parents and say, hey, if you're with Medicaid, you are already qualified for this type of program, and these are the benefits that your kids will get. They'll get a mentorship with almost like a big brother, big sister program. These kids are going to be taught life skills that will help better themselves. And by the way, it costs you nothing. Kind of hard to say no to that as a parent. And that's why we're so successful on getting these kids to sign up.
Yeah, and I think that was one of my questions before is like a dentist office or a doctor's office. So many times the kids don't want to go, but when you kind of put it like, how often does a kid get to hang out with, a kid come out of college, just got his degree to be able to hang out with like a mentor and like a big brother or big sister, they're going to be excited to go and, maybe go do something with them or go to the park or, just hang out. And I think that's the power of this. We're not dealing with, medication. We're not dealing with surgery. We're just basically support for them and a mentor to them. And it makes me want to go out and get my social work degree because I think that'd be such a fun job to be able to help these kids like that. I think that's a really special thing. How many hours, is there a max on like how many hours per week the kid can be seen or what's that work? Is Medicaid like limited to how many hours per week or month?
Yeah, so most of these kids, they see the QMHPs anywhere from 2 to 4 hours a week, unless it was deemed crisis. Like, say for example, crisis could be a lot of different things. People think crisis has to be involved around something major, like a school shooting or something like that. No, anything deemed crisis is if the kid is under any risk of hurting themselves or hurting others, right? And whenever the case is deemed crisis, they get unlimited hours for 7 days.
Yeah, that's good to know.
And then here's another thing. I mean, this is probably getting ahead of ourselves a little bit, but RVs are pretty prevalent and cheap due to the fact that so many people bought it during COVID, and now they're desperately trying to get rid of it. So we're actually thinking about not thinking. We're actually going to be putting mobile crisis centers where we get QMHPs to actually go to these crisis events. Like, say for example, if there is a school shooting, I mean, think about it: unlimited billable hours for however many kids. And by the way, it's not 102; it's double.
Oh, it's
Wow.
double. So during a crisis, something like that, you get $200 an hour.
Oh yeah, yeah.
Wow, that's crazy. Can you talk a little
Guys,
bit
like I
about?
mentioned.
Yeah, go ahead.
Yeah, go
Sorry.
ahead.
No, I was just going to talk about, putting these centers down by the border of Mexico and, what can happen there too, like advantage of having it down on the border there.
Yeah, so let me backtrack a little bit. A couple of things we want to do for Texas Care. Remember the brand building aspect of things? So that's one of the reasons Anton asked me right from the beginning, if these clinics are doing so well, why do you need investor money? And my answer to that is we need to blitz the market, right? And we need to build a brand as soon as possible. And my goal is to get about 500 to 1,000 of these centers dotted all throughout the state of Texas, and build a brand that is so strong with our community outreach people. Go out there and basically educate the public, educate the facilities, educate the social workers. So I want a brand that is so strong that whenever a social worker picks up the phone, we're the only number that they call. On the medical side, there are a lot of brands. If you think cancer, you automatically think MD Anderson. If you think, at least here in Texas, if you think children's adolescent care, you think Texas Children's Hospital. But on the psychiatric side, there are absolutely no brands, and that's what we're trying to change. And another thing about this is taking a chapter directly out of McDonald's playbook. So when Ray Kroc was launching McDonald's, his focus was more locations, more locations, more locations, right? So for us, I'm trying to learn from that aspect is, whenever somebody came to him and said, hey, some of our competitors are selling chicken sandwiches, we should do that too. And he said, nope, we're going to focus on more locations, right? And then somebody said, some of our competitors are putting little toys in children's meals. We should do that too. And he said, nope, we're going to focus on more locations. And then, one day he walks into the boardroom when he has locations from coast to coast. He said, we're going to start selling chicken sandwiches. And next thing you know, overnight, they became the largest distributor of chicken sandwiches in the world. And one day he walks in and says, we're going to put little toys in kids' meals. In fact, we'll call it the Happy Meal. And overnight, they became the largest distributor of Hot Wheel cars and little Barbie dolls in the world. That is what I want for Texas Care, right? Once we have 500, 600, 1,000 of these locations throughout the state of Texas, the moment we add another layer to this, like say, for example, substance abuse, we will become the largest substance abuse centers in the state of Texas. The moment we add a day program, we will become the largest day program providers in the state of Texas. And, going to Anton's question, on the border, I don't care if you watch CNN, MSNBC, or Fox News, everybody talks about the border crisis. There are millions of people pouring through the border. Now, Fox News, if you're an avid Fox News watcher, they deem these people like terrible people. I'm not going to say that doesn't exist, but the vast majority of these people that cross over, there are millions of them, is they're seeking political or they're seeking economic asylum. Well, guess what? Two things happen. Especially whenever these people cross the border, they immediately turn themselves over to immigration. Two mandatory things happen: mandatory psych evaluation with a background check and mandatory drug screening. So once we dot the border with 100 of these locations and we get the substance abuse qualification, right? For us, those CLIA certified cups cost about $1.95 a cup, and we get to build a state of Texas $12. You see where I'm going with this?
That's awesome.
I make a joke, and you guys probably heard it already for those of you that talked to me already, but make artillery shells, so I can't take advantage of the crisis in Ukraine, but hell yeah, I could take advantage of the border crisis here.
Yeah, absolutely.
I just had
All
one
right.
quick question about the staffing. How many, say if your location starts to get, 35, 40, 50 kids, how many social workers are you going to need to cover that type of
So
clientele?
the QMHP, for each QMHP, a full workload is about 12 kids. 12 to 15 kids, depending whether you're seeing them more on the 2 an hour versus the 4 an hour, right? And corporate will actually hire and train every single one of your QMHPs. So that aspect of it grows. And all of these QMHPs are 1099 employees. In fact, we back their pay 30 days. So you don't actually pay them until the state pays you.
Great, thank you.
Yep. Yeah, one of the things that we've been talking to Andrew about too is I thought to myself is, we're making a pretty big spread is, the ability to offer, good benefits to all the QMHPs, setting up a benefit program, starting a life insurance policy, IULs, health. We're working with a healthcare program called Impact Health right now. It's a very, very good nonprofit. Paul, who's on the call, was the one that introduced it to us. But it's a good way to offer, different types of benefits that most 1099 employees, wouldn't have access to, which is pretty cool.
It's very cool, actually. So some of the questions that I asked an investor myself actually had was, hey, if we're growing this quickly, how can we hire and train the QMHPs at such a rapid pace? So that fear was alleviated when we at corporate decided to pay the QMHPs $5 over what the market rate is. And whenever we did that, we did one ad in the city of Houston, and that one ad generated over 500 applications. And then, especially if we provide an ability for them to get healthcare as well, I think we're able to get the retention because we are paying more than everybody else and we provide benefits.
All right, awesome. Does anybody have any other questions that we can ask Andrew when we have him on here?
Yeah, I got a quick retention question, as you just mentioned. If we have a QMHP that immediately leaves for whatever reason, how quickly are we able to get a new one online and continue services?
So, a couple things that we're doing from a corporate standpoint, we're actually streamlining this. We have built in an entire online training process. So, the QMHPs no longer have to come into the office to get training. All of this platform is done virtually. So, any new QMHPs will, so they don't have to wait until the next training schedule or anything like that. As soon as we hire a QMHP, they go through all of the background and all the hiring process. Immediately, they can get online and get all of their quote unquote certifications and all the trainings through our virtual training program, and they'll be able to work very, very quickly. And our goal, because we're growing so fast, is constantly hiring.
I had a question about say if we wanted to get another location or multiple locations. Say, we get our LLC set up, we have one up and running, we go for a second one. Do we still have to go through the same process of the 6 months wait, accreditation, and all that if we link that to the LLC and just kind of move quickly?
So, regarding the LLC, yes, yes and no. If it's in the same zone with the same owners, it does cut down the accreditation process by about 2 months. However, we just had a talk about this with both Eric and Anton. Is that every single location with the Medicaid process will have their own EIN number. Now you don't have to set it up like that, but by setting it up like that as a separate entity, you got a couple of different benefits. Number one, you get to track which location is doing what. That's a huge benefit because if it's just one EIN number with one LLC, all of your billing and reimbursements go into that, and you have no idea what came from where. That's number one. And number two, although this is deemed very, very low risk for Medicaid and for the state of Texas, Murphy's Law does apply. There may be an audit, and if you're affected by the audit, your payment system stops for that particular location. Now, if you're grouped all, like say, for example, if you have 10 of them all grouped into that, versus just one location that's being audited, that is another huge benefit that you're protected from.
All right, great, thank you.
I would like to add, part of the process that Eric and I kind of saw when it came to this, and this is kind of off the subject a little bit, but Eric and I have been studying trusts for a long time and seeing the advantage of putting this into a trust. So we're going to have a system where someone, once they start getting paid, we start a trust for everyone, and then that money goes into the trust tax deferred. So if we're making, $20,000, $30,000, $40,000 a month, you're going to want to have a trust set up. So then all of that passive income goes into the trust. With that, you can put your house in the trust, your cars, you can basically run your entire business out of the trust, and then, save a lot of money on taxes. So that's something that Andrew's going to do. We had him talk to our trust guy, and he loved it. And we're going to be able to bring in, show that same process for everyone that does invest with us too.
Sounds great.
For sure.
Would that be kind of similar to like where you can take your money out tax free? Or how does that work exactly?
Yeah, I'm going into a busy place. Eric, maybe you can explain that if you don't mind.
Yeah, there's ways to distribute. I mean, many times if you distribute from a trust, you're going to pay taxes. If you have a home, there's ways to put in, your house goes in there and you have you put your house in there for what it's actually, what it's valued at, plus any improvements you put in, plus your tax, like if you're married, you add another $500,000 on top for like the tax, that tax rule where if you sell your home, your own home, you can take a $500,000 up to $500,000 tax free. So you add that on there, and then you can draw from that difference on the house, and you can draw from that tax free. So there's ways they teach you how to live within the trust to be able to pull out money tax free. Otherwise, if you don't have that, if you do distribute, then there'll be taxes on that. But yeah, definitely something that everyone should know about. It's a good thing just to kind of learn, and it could really change, especially with this, with passive income. There's the opportunity to defer 100% of the taxes for generations, for like decades or hundreds of years. You could defer those taxes. And typically what you do is you'd have your kids be like the beneficiary if you have children, and then you'd have an insurance policy built into that where when you do pass, the insurance would kick in, pay off all those taxes, and now they have it all tax free, as an asset to them. So a lot of strategies around that. So things that we're gonna be putting out more video on that probably soon and kind of teaching people, but something to put in the back of your mind. I also wanted to add, Anton and I are planning on getting down to Houston sometime in May. So we're going to we'll put out the word to everybody, and anybody who wants to go down there, and Joe, if you're there, we'll be coming to your house, of course. Yeah, anybody who wants to come down there, we're going to go visit corporate and everything, and get a chance to everybody get to kind of know each other too, and just meet up. And so it's going to be awesome. We're just trying to pick our dates right now, so we'll get that out soon.
You said that's going to happen in May?
Yeah, we're shooting for May. So, if May, if not like June, like sometime in the near future, hopefully the next like 30 days would be great. If not, 30, 45 days, something like that. But whenever we can make it happen.
Okay, cool.
I got one more. I guess we can just ask, what would cause this to not be successful in a way? What can cause, is it location, right? What kind of risk are we assuming with this franchise?
Right. So, I'm definitely one of those, prior to me getting involved on the corporate side. And to be honest with you guys, I put my money where my mouth is from an investor side. I'm owner or part owner of 12 of these facilities. In fact, I'm so passionate about this, I decided to join the corporation as the director of business development and chief marketing officer. And I'm actually not even taking a salary. Well, let me stop lying. They had to pay me something, so I'm getting paid minimum wage. I'm getting paid $7.25. So I do have to disclose that. But I asked the very same question. What are the major the risk as an investor? And the major risk is, hey, this thing can be defunded, right? But cost protection that made me feel really, really good about it is Texas is a very wealthy state. We actually Texas Medicaid actually does not draw from the federal budget. It is all solely funded from the state of Texas. In fact, for those of you that live in Texas, our property taxes are insane. It's one of the highest in the country. Well, this program draws its money from Texas property taxes. And for all of us that live here, if you ask any of us if you think property taxes are going down, the immediate answer is probably laughter. That is number one. And number two, this is a program that has a proven track record to work really, really well, and it winds up saving the state a lot of money, and essentially taking what society deemed, little terrorists or complete rejects that would not amount to anything. In fact, a burden to society, teaching them the life skills and turning them into productive tax-paying citizens. So it actually is a program that works really, really well and works with kids. Tell me which politician is going to run on a platform to defund this program. I don't see it happening anytime soon.
I'll add to that too. You talking to Charlie, the owner, he mentioned, I asked him too, like, go back like decades, what's the price range of these codes been? And it's really averaged from like mid 90s to this $100 range. And I think continues to go up, like everything else in life, things go up. So it's been like, I think he said like 20 plus years of it being in that range. So it's not going to just tomorrow go to 50 or something like that. It's been that way. It's going to probably most likely continue to be that way for years and years to come as well.
This is definitely the type of program that only works in a handful of states, Texas being one of them. In the state of Nebraska, the exact same code actually pays more than Texas. However, the entire state of Nebraska has less population than the city of Houston. So I believe Texas is probably where you're going to get the best in terms of population, and it's a state that is continuing to grow in population, and it's a very well funded and very wealthy state. So that eliminates a lot of that risk for us.
And then I have another question for the funding. It seemed like, was it 65,000 if you wanted to fund the whole thing, and then you can do shares of it, which was like 10,000. Is that correct?
Yes.
Okay, and
Yeah,
then
we-
is there any limit on how many you can do?
No,
Cool.
no, you
You know
can
what?
do as
I'm not gonna
many
speak for it.
franchises as many shares as you want. So you could do, 3 shares, 4 shares. You could do, 10 franchises. I think, Andrew, I think you have 12 yourself, right?
12.
12, and
I'm
then I think you have
collecting
a
these
couple.
apparently.
but that's something that we're offering ourselves, like on a, so we put the deposit down, we're starting our own franchise, but we're going to sell shares of that, and then we're going to continue to get more franchises as we move forward and offer shares. So it's on our site that we built out, but we have a landing page for it. But right now what we have is it's a 10K investment, and that would get you 7% of the net of one of these centers. So it equates to probably, I mean, like these numbers we give out always sound too good to be true, but I mean, you're looking at probably $1,000 to $2,000 a month on a $10,000 investment, on the, like on the mid range or low end, maybe potentially even. So it's pretty insane what the numbers are looking like. So we're offering those to people. We are doing there's an affiliate option here too, where you can make a referral if you know anybody that wants to come in too. So there's some commissions we can talk about there too. So anybody, if you want to bring them in, just connect them with us or Andrew, and we'll connect them, and we'll get them, we'll get on with them or whatever we need to do. And just let us know.
Yeah. And for all of us on the phone right now, for anybody that says, "Hey, this is a program that's too good to be true," I would, the reason why it's only $65,000 right now is because we're proving a concept right now. You are basically getting to be a part of this at the ground level. Once we have 50 of these going with solid P&Ls that each one of these locations is doing $20,000 a month, trust me, guys, it would not be $65,000. These are basically our, it's kind of like the founders club, so to speak. You are taking your risk with us, and yeah, you get to get rewarded for that.
Well, Andrew, I didn't hear anybody say they have any other questions at all. Well, we appreciate everyone that came on the call. Thank you so much for your time this Saturday. And if you have any questions, you can reach out to us on WhatsApp, and we can get any other questions you guys have. And we're going through the process right now of the accreditation and getting everything set up. So we're going to be documenting that aspect of it to kind of show every step of the way of what we're doing. What links you need to go to, some education, some market research we've kind of compiled as well. So we're looking forward to working with all of you guys, and I hope you guys have a blessed day.
Great. Thanks, Anton.
Yeah. Really looking forward to it, guys. And thank you so much for your time. And I'll end with this. If we do this right, guys, not only are we going to make a lot of money, but most importantly, we're going to be able to provide a lot of help to a lot of kids that need it the most.
Yep.
Thank
All
you.
right.
Thank you so much.
Thank you so much, you guys.
Amen to that,
Thank you so
Andrew.
much
Yep.
yes, sir.
All right. You
And
guys
thank
have a
so
great
much
day.
for